Typically, when we talk about osteoarthritis, it's wear and tear arthritis. It occurs over time. So osteoarthritis is a progressive condition. Once you get it, it'll only proceed to get worse. And if conservative treatment fails, and that's anti-inflammatory medications, braces, and physical therapy, then we're left with surgery. And I'm a specialist in total joint replacements, knee replacements, and total hip replacements.
Well, there's no cartilage left, it's bone on bone, and it's painful when I walk, and it buckles on me. You know, you're walking along and all of a sudden it just gives out on you. So
I realized that, I had my entire life ahead of me, and I couldn't keep going down the road I was going with the pain that I had, and it was affecting my social life, my personal life, and I realized it was going to affect my entire life if I didn't do something.
People used to think of a total knee replacement as an extraordinarily painful operation. So for the last 15 years, we've been working on how you make the surgery less painful. And that includes using smaller incisions, less trauma to the soft tissues, and recently we've been starting using different types of navigation that allows us to do a smaller incision while still maintaining accuracy. In total joint replacements, alignment and orientation is imperative. It's very difficult to make certain that you're putting your hip in perfect position or your knee in perfect position. That's why it's been shown by using a system like the knee align, you can be 4 times more accurate than the standard knee align systems. As far as a hip align system is concerned, there's no other way out there where you can be certain that your pelvis is exactly in neutral position when you're doing the surgery. Typically, when you're doing the surgery, the pelvis may be tilted 10, 15 degrees one way or the other. So even though you think you're putting your components in perfectly, the reality is you're not, because the pelvis is rotated. When one does a hip replacements, there are numerous ways of entering the hip joint. The typical way that it's been done over the past 20 years or so has been the posterior approach. It's what we call the gold standard. The problem with the posterior approach is you cut through muscle in order to get to the hip joint. And then after the surgery, you're often sitting in the wound, and those 2 reasons cause pain. The direct anterior approach is an approach where you approach the hip going between 2 muscles, and it's actually possible to do the entire surgery without causing any damage to the muscle. Less damage to the muscle means a faster recovery, less pain, and it's not uncommon for patients to go home the next day after surgery and get rid of their cane within a week after the surgery. When someone does a direct anterior approach, it's very important that we're able to position the leg in a different manner in order for us to get to the hip joint. As a result, the surgery requires a special table. There are 2 types of tables that are commonly used today, the Hanna table and the arch table. Both of these allow you to position the leg in order that you're best able to enter the hip joint from the front with the least amount of trauma.
And the approach that Dr. Buchalter uses with the minimally invasive surgery through the anterior as opposed to posterior made the world of difference in recuperation. And I virtually had no pain. I took the painkillers that they gave me when I was in the hospital, and I basically had no painkillers since.
People always ask me when should they have their hip or knee replaced, and I tell them it's very simple. When there are things that you want to do that you're prevented from doing because of your hip or your knee, and when you do that, you have significant pain. So there's no reason why you need to just live with it, because as I mentioned before, arthritis is progressive. So every day your arthritis will get worse. So once it reaches a point where it's starting to affect the quality of your life, it's time to consider surgery. I've been in practice in South Florida for 27 years, and I probably have done 3,000 hip replacements and 3,000 total knee replacements as well.
Well, the concept that they can replace your hip is, absolute miracle. But the fact that they were able to do it with the anterior approach with so little pain is magic.